Welcome, and thanks for listening to this week's episode of
The Milk Production.
The Milk Production.
Thanks for listening to another episode of the Milk Production. I, as you can see, am your solo co-host today. I'm Meaghan Selki. I'm a lactation consultant, mother to 5 beautiful boys. Love to sit around the fire pit and play family soccer. I have got what I think is a great interview in store for you today. I have worked with a mom from a prenatal lactation consult to babies, in about the 18-month period right now. So we've spent a lot of time together, navigated several different things through her journey. She has great perspective to offer, and as a mom of 2, this is her second, and so has sort of the hindsight of what she wanted to do differently from what she learned with her first, and also what she did with her second that she did or didn't love, and just some tidbits of information to share. So if you're in the prenatal period, then this is definitely for you. She's got some great tips about how to line up the support that you need now so that you're not dealing with it when you're in that sort of hairy postpartum recovery phase where things can be a little bit stressful. So without further ado, let's cue up that interview. Tell me, what motivated you to do things differently, and what types of things did you want to do differently from your first breastfeeding experience?
Okay, so my first breastfeeding experience, I always tell people it's really funny because I said I didn't have a birth plan with my first baby. All I had was a feeding plan, and I knew that I wanted to breastfeed, and I didn't really put much more thought into it than that. That was pretty much the plan. But then I didn't realize how little I had done to actually prepare for that. All of the emphasis was preparing for birth and getting yourself ready for birth. So then, not having done really any preparation for breastfeeding, I just feel like no one really told me that this was an important part of it. You have your, initial visit with the pediatrician office and interview them, and no one really said, hey, have you thought about getting lactation support? It just wasn't even part of the conversation at all. So my first feeding experience was just wild. My little guy dropped close to 10% of his birth weight. We were at the hospital for a few days and he was super jaundiced. We came home and he was turning orange. He was yellow, he was orange, he was really, really, he went 24 hours without a wet diaper. He was just super fussy, but I hear, newborns cry, right? So you just kind of figure if it's your first kid, you don't have a baseline of what's normal for you. And I kept going to the lactation consultant at the pediatrician's office, and she could just see how much I was struggling. But it was so difficult to spend 24 hours of the day trying to feed my baby and then have 1 hour once a week or twice a week those first couple of weeks to try and fix what was going on all those other hours. And ultimately there was some attempt to exclusively pump for 2 months. There was some attempt to, you can come in if you want, you're allowed to. There was some attempt to triple feed, and ultimately it just ended up being a disaster.
Yeah, triple feeding is the worst. I may have told you about this before when we were working together, more in the beginning, but I firmly believe that triple feeding should be a 24-hour solution and no more. Yeah. Because it tasks you from a mental health perspective so significantly.
Well, and I was at the point where I feel like anyone in those early days, regardless of how you're feeding your baby, really does, it feels like feeding is a full-time job. And so being told, okay, you're going to have to attempt to latch at the beginning of every feeding, you're going to then have to pump, and then you're also going to have to feed formula on top of that and manage to prepare all 3 of those things. They all have a different process. So it's like doing 3 processes every 2 hours and sometimes more than that. I couldn't do it. I was really it felt like there was no end in sight for that.
Yeah, like I said, 24 hours is what I firmly believe. After that, are there ways to make it manageable? Yes, but then it changes from a triple feed plan to either breastfeeding or pumping. And if there are times where you have the ability to try both, great. But if you're doing that at every single feed, you're never going to sleep in between. You're probably not eating much yourself, which affects your supply. And there's just, it's definitely not a permanent solution. It's more important to address why a baby's having a hard time transferring than it is to keep doing that just to protect your supply. Like you got to kind of look at the higher level view, I guess, in my opinion.
Yeah, and there was also with my son, there was this whole other level of complexity because he had really, really severe reflux. He had a variety of GI issues that we only recently, over 3 years later, figured out what was going on there. And um, I kind of realized looking back that because of my mental health and his health issues, he ended up having to be on super, super, super hypoallergenic formula anyway. Like, regardless of what I cut out in my diet, he was just still getting really sick. It was really one of those rare cases. But I also knew that the likelihood of that happening again the second time with a second baby would probably be pretty low. And it was. I needed to prepare myself for a lot of the things that I didn't know the first time. Um, like suspected tongue and lip tie. We still think that my son has that. And within 2 weeks, my daughter was in getting hers revised.
Mm-hmm.
And
Mm-hmm.
I believe it helped. I mean, I'm not an expert yet,
Yeah.
but
Yeah. Yeah, right. Hi, lady.
she
Look
likes
at
here.
you. Look how long your hair is.
She's gotten so look, she's like, yes, your hair.
What a cutie pie. Oh, how sweet.
Can you say thank you? Oh.
Oh, you're such a sweet girl. Look at you. Oh my goodness, what a sweetie pie.
Do you need, are
Um,
you, is it okay that she's here?
oh yeah, it's totally fine. Yeah, we're just gonna keep going. So the episode that we released, what will be last week, um, we talk about the 10 reasons why you would want a prenatal lactation consult, because I do think, like you talked about, it's an currently undervalued thing. Um, Even childbirth education classes are incredibly common, and people understand why inherently you would want one, because it's like, how do we get this small, this relatively large object, albeit a small human, out of a very small space, and you want education on that. But the reality is, you go through labor and delivery in a relatively short term in comparison to how long you'll be breastfeeding. And so you have those challenges. They stay with you, sometimes for the duration of your breastfeeding. You wonder about your supply or something like that. Now, hopefully you're troubleshooting in the beginning with some early and often support. And then from there, you feel like you've got it and you can kind of handle it. But even just having the support lined up for when you need it, it's like, it's not okay, I know what I'm doing, I don't need the support. It's part of it is just knowing that you have the support lined up. So that was one of the things that I wanted to talk about too. We did a prenatal lactation consult together for your first visit, and I thought that was really great. You are definitely one of the more rare people that I work with, because usually they're calling when there's already an issue. So I thought that was really good, really smart. What led you to that? Making sure you lined up that resource and everything.
I think with me, sorry, I've got this little one who doesn't know what she wants right now. It's like, I figure I'm allowed to nurse during a
Yeah.
breastfeeding podcast, but it's
Yes,
the only thing that's going to
exactly.
calm her down right now.
Yeah, yeah.
Um, but, I think for me, time, I think for me, I figured the likelihood of something happening again, regardless of what it wasn't out of the question. And I also knew that breastfeeding is a skill that is developed. And it doesn't always come easily to everyone, which I think is one of the big misconceptions. And I knew that I wanted to get ahead of that. and be prepared and have a support system in case anything happened. So I wasn't necessarily going into it saying, okay, I'm preparing for the worst, but I also was thinking about it from the sense of, if something does happen here, I want to be ready to handle it. And I want to have someone on standby that can help me handle that. And I mean, you remember I was calling you like within 24 hours.
Yeah, but that's good. That's what we want. I mean, I was just talking with one of my lactation consultant friends who was going to see a mom who hasn't gotten lactation support since the hospital, and the baby's 2 months old. And it's like so much happens in those first few weeks, few days even. Um,
I don't
she's
even
so
mind
cute.
if you include this. You can include all of this if you like. This is
Good.
why I got lactation support, so I could be 18 months into this and
Still
still
going
having these
strong.
moments.
I love it. That's so cute. So I think that's really good. What about the other areas of support postpartum? So one of the things that I find really important to talk about as a society, a culture in America, is postpartum support and sometimes lack or often lack thereof. So there's other areas. So you were, very keen to line up that lactation support, and that was so good that you did it. Did you feel like you were able to do that in other areas, or did you feel like other areas were challenging in terms of obtaining that postpartum support, particularly for you when you were recovering, but of course for you and baby, for as needed?
Yeah, that's a great question. So interestingly, I knew that I had had postpartum depression with my son, largely because of I attribute it to the lack of support with feeding.
Yeah.
I say this because I really didn't have postpartum depression the same way, at least with my daughter, this baby right here. I didn't have postpartum depression classically. I would say I had like some situational anxiety and like transition stress, but I never experienced the postpartum depression that I knew was very classic postpartum depression that I had with my son. So, kind of like similar to getting ahead of lactation support, I knew that I had postpartum depression with my son, and I ended up getting prenatal support for my mental health. So I've always, well, not, I wouldn't say always because it took me time to get educated on it, but I would say since college, I got really educated on using medications for mental health and seeing a psychiatrist and those pieces of the medical system. And I advocated for that care prenatally with my daughter as well. Um, but what ended up happening was, excuse me, blowing raspberries on me. Excuse me. Um, what I noticed as well, though, was that there is a big uh, limitation on the amount of providers who are qualified to handle someone either during the prenatal or postpartum period. And so I ended up getting in with a specifically trained prenatal and postpartum psychiatrist. And she was able to then connect me to a postpartum certified therapist who I still see a year later, actually.
That's so awesome.
But the issue with that, though, is I mean, there were a handful of providers with those certifications. There were a handful I think there was one therapist at this practice. And this practice is one of the ones in the area that is known for being the postpartum depression clinic. She just muted me. And it's known for being the postpartum depression clinic, and they only had, a handful of maybe one therapist who took these clients.
Oh, yeah. That's so tough. So it's like it's a limited number of resources,
Yeah, and
even
I
when
mean,
you line it
I
up ahead
got
of
ahead
time.
of it from the start. What about someone who is really desperate and, they don't know that these resources even exist, and then they go to seek help, and they end up having a 3-month wait list.
Right, right, right. Like when you need it the most, when you need that help the most. What about like around the house? I know you have maybe family in the area. Just, balancing with your husband. Did you feel like that was a little easier this go round? Still some challenges?
It's really interesting because so much of this has to do with my work situation.
Mm-hmm.
And, I worked from home during this period. She had to go to daycare. Hi, do you want to go down, down? She had to go to daycare at 8 weeks old.
Mm-hmm.
What do you want, honey? Okay, more boo-boo. More boo-boo. Okay, there
Boo
you go.
boo.
She sat up and then she said, more boo-boo, mama. Um, but um, I think that overall, the whole postpartum experience this time is easier
Mm-hmm.
for me. I think my son was more medically complex, and also I didn't have the lactation support, and my postpartum depression was from feeding.
Mm-hmm.
The difference is that this we were in a much bigger home, so more to logistically maintain.
Mm-hmm.
But also my husband didn't have a real paternity leave the first time that we
Oh,
had
yeah.
when we had our first baby.
That's
So
tough.
he was home for maybe like he was not working for maybe 2 weeks, and then he was working remotely thereafter, something like that. So the fact that we were able to navigate this time as a family,
Mm-hmm.
and he was able to be more hands-on in that way was a really, really big help. And it was good for us to have that time to bond as a family too. But there's
Yeah.
also more space to cover in our new home.
Mm-hmm.
So it definitely took me time to get used to how to maintain that. And I think I'm still figuring that out, little tricks
Yeah.
here and there as we go. But I think that's part of having two young kids.
Yeah. Well, you went from like the adults outnumber the babies to now you're doing man to man. And so,
Oh yeah.
when you're feeding, maybe he's with your son, and then
Yeah.
when you want some time with your son, maybe he takes your daughter. It's just there
Yeah.
are those challenges as well. So,
Yeah. And I mean, they're exactly 2 years apart. And I knew, like, I always I know, not everyone has the exact wish of what they want, but I was very fortunate I wanted to have two under two, and I had two under two for like a week. And I mean, it really does test the limits a little bit of what
yeah.
you're capable of.
Yes. But you're capable of it. So good for you. So, one of the things that we've talked about, and I want to, like, we've obviously alluded to because she's nursing right now, is that you're still breastfeeding over a year. Definitively, that's called extended breastfeeding, which I think is kind of a funny term because the recommendation is to continue breastfeeding over a year as long as it's desired by mom and baby. So it's just like normal breastfeeding. What are your thoughts on extended breastfeeding? Are you enjoying it? What do you like? What's hard about it? What do you want to share?
Oh man, this is a great question. Um, I love it.
Uh,
I thought about weaning. I
mhm.
thought about weaning, as you know. I've talked to you a lot about weaning, and
Yeah.
ultimately, I felt like if I would have weaned, it would have been because I was forced to, and not because I really wanted to.
Mhm.
My full plan has been to follow her lead
Mhm.
and wean when she's ready. And if I'm going off what I know and what I feel intuitively, she's not ready.
Mhm.
And I
Mhm.
feel like weaning before she's ready. Now, okay, if she's trying to nurse till she's like 10, I'm gonna probably be
Yeah.
like, okay, I'm ready, hon. I'm
I'm a
ready.
little tapped out. Yeah.
I don't, that's not gonna happen. Like, I
Yeah.
know the course of biology enough to know that that's not going to happen. And I
Mhm.
know that when she's ready, she will take steps back. I mean, she already has.
Mhm.
I think the biggest thing I've learned is to not rush the process and think, oh my gosh, I have to drop X amount of feeds now, or I have to
Mhm.
count how many minutes I'm nursing, or how
Mhm.
many seeds I'm having per day,
Mhm.
every day. Like, some days will be different.
Mhm.
I really like this stage of breastfeeding because I'm at a point now where I don't need to stress over the ounces or the how
Mhm.
full I'm feeling, or like the different logistics of it. I can just kind of enjoy that time with her. I
Yeah.
also wish people realized that extended breastfeeding has a purpose beyond just comfort, but
Mhm.
also even just comfort is a purpose.
Agree. Completely agree. Yeah, all of those are really good points. And I think that's another thing that I recently put something out there about. It was like a behind the scenes look of Jackson nursing. And one of the things that drives me crazy is people ask like, well, when are you going to be done? And I'm like, that's a very complicated, multi-layered answer. Like, do you really want to sit down and talk breastfeeding with me, or, or are you just feeling uncomfortable because my 2-year-old still nurses? Which is it?
There?
Yeah, yeah, exactly. But it's multi-layered, and I think obviously there's still the immunologic benefit, which is great. I mean, I can tell you he's had hand, foot, and mouth disease probably 3 times, and sometimes the only thing he wants to do when he has that is nurse. And I don't know. It's been when he got tubes in his ears. It was very helpful when he came out of anesthesia to be able to nurse through that sort of difficult period. Whereas the 12-year-old in the room next door, was very distraught, and you could hear. And that's a completely different age, but it was almost like I think she had her tonsils removed or something. But regardless, it's like it's hard when people come out of anesthesia, and that he was young enough and that we were still doing extended breastfeeding is like very, very helpful in that moment.
Yeah.
So
Even with both of my kids, when she's gotten sick, it's been a completely different experience than when
little
than
sweetie.
when than when my son's gotten sick. I mean, like when he had hand, foot, and mouth and he was formula fed, we almost had to take him. Well, we did take him to the emergency room, and they said, if he doesn't get X amount of fluids in X amount of hours, then we're gonna have a very different conversation. But for her, even if I know she's not interested in eating, like yesterday, I went to the doctor with her. They said that she might have a bit of an ear infection. She wasn't eating a lot, but she's taking a lot of nutrition in still from nursing, and she just nursed extra.
She did.
Yes.
That's so good. Yeah, I think it's great. I think it's a great tool. I also think it's totally fine to be done with it whenever anyone's done with it.
Yeah, and that's the thing too. Is like I'm never going to be the mom that tells other moms just because I want to extended breastfeed that you have to. Like
right. Yeah. So I think that's good. I think it's good to share. I think it's good to show people that like extended breastfeeding doesn't look weird. It's just and I, like you, completely agree that it's like my favorite part of nursing. Hi, cutie pie.
It's so much easier than any of the other. Dude. It's so much easier than any of the other points we've been at in our journey. And I feel like when I thought, in the early days, let me move this camera. When I thought in the early days about what I wanted my breastfeeding journey to look like, it was this. And I felt like there were a lot of points where I had to get through really difficult times to know what was coming.
Yep.
And now that I'm here, I'm like, oh my gosh, I'm so glad I stuck with it.
Yeah, I completely agree. I love that message. So one of the other things I wanted to talk about, and something that we've talked about in great detail recently, is sort of this the GLP-1 type medication. So I don't know how the one is pronounced that it's the
Zepbound is the one I'm on.
Tirzepatide, yeah. And then semaglutide is one that a lot of other people know. All of these being the sort of same category of medication for weight loss. Obviously, it's been in the press a lot lately. Very helpful for people. There aren't any studies done on it for nursing moms. And so you've experienced some trepidation from some providers about whether or not to go that route.
Yeah.
What did you ultimately decide? And you want to talk about that journey a little bit?
Yeah, sure. So I ultimately decided it was worth it to try. It was worth it to try the medication, with the caveat of knowing that not only do I have to monitor myself for side effects, but I also need to monitor my baby if I'm nursing. I found it just absolutely baffling, though, how confused the providers that I was talking to were about this. When I would call or I would go to an appointment and I would ask them sorry, she's flashing me. When I would call and I would ask the provider, she cannot decide which boob she wants. Make a decision, woman. Oh my word. When I would call and ask the provider basically what the guidelines were, I would get this runaround answer of, okay, we're going to look into it. We're going to call you back. We're going to, do some research on it. We're going to talk to other providers. And there were times when they even said, oh, of course it would be fine. Why wouldn't it be fine? And I said, well, someone else at the practice said it wouldn't be fine. And then I would get call back, oh yeah, it's actually not fine. You can't take it. And no one was able to really give me any reason other than saying there's not data. To which then, of course, we talked about at length and recognized that, yes, there is data on it. It's just that the data isn't that there's a specific study around the safety yet. But we can make educated guesses. And to me, like, I feel like I've, done things like eat unhealthy food during my pregnancy or, eat unhealthy food while nursing. And in my mind, putting something in my body that's going to ultimately help me become a better mother and have a better quality of life with my kids is worth that small amount of uncertainty.
Yeah. And so, just talking about a little bit about the data that we do know, we know that the molecular weight and size are one that sort of decreases the amount that gets into the milk. And then also that it's less available for baby to digest when they're taking it in orally. So that which does get into the milk is like, not as easily digestible for them anyway. So with that data that we do have, and the other thing is there's the big risk is if you were a mom of a 1-month-old who was a preemie who wasn't gaining well, that might be a different story. But, you're in the extended breastfeeding period, which is like where everything's easier, like we just talked about. And, this is hopefully, we see that the risk is being minimized because she's no longer nutritionally reliant upon you. And she's eating solids. So I think you've made a great choice for yourself. I think you've looked at the data that we do have and talked to a lot of people. And, I admired your patience in trying to get providers that were breastfeeding friendly.
That's what I was going to say is that was ultimately what sealed the deal for me to feel safe trying it was finding one of these breastfeeding friendly providers. But if I hadn't had you as a resource to help connect me, I would have weaned and I would have, risked a lot of other areas like my mental health, weaning before I was ready and the stress of navigating, taking care of her, knowing that she wasn't ready and having to learn new ways of navigating that. I wasn't good to navigate all of those pieces either. Yeah. And so it's just upsetting to me to think, how many people are told, oh, just wean to start this medication, but it's not a just wean when you really have invested this your journey. It's more than that.
Yeah, I completely agree. I think you said that well. And I think it is tough because it's like not everybody has access to that. Not everybody knows they can get access to that. So hopefully that's something that we can do a good job of spreading the word on that.
I don't think not everyone even knows that breastfeeding friendly providers exist. Not everyone even knows that they exist. So you're so mad.
She's like, all right, mama, come on, I'm done. Well, that's really it. I mean, I don't want to keep you. You guys could go snuggle. Is there anything else that you want to share? I mean, anything that comes to mind that you feel like, I think it's a great point that you bring up that knowing that there are breastfeeding friendly providers is not even, I guess, communicated well to the community, or certainly not at least to our community here in Northern Virginia. But
I think the other thing that I would say is lactation consultants practice differently from each other too. I don't know how much I want to get into that here, but
oh, please, whatever you want to add.
I think that, like, I had one lactation consultant with my journey with my son who said, this is postpartum depression. Is this journey really worth it? And looking back and knowing that my son would have probably needed to wean for reasons that are incredibly rare and uncommon anyway, um, I I struggle looking back and realizing that I could have had some of those, a slightly different mindset and a different approach. And I also hear just so much misinformation out there around breastfeeding and around feeding in general. And I really do personally like to take the approach of, what's best for mom and baby, is really key and really important. But I also think that educating parents with facts is really important.
Yeah.
And I think it's just we're in this space right now where just like different providers practice medicine differently, different lactation consultants can give different advice. And I think it's really important to find someone that values the right things and is going to be willing to connect with you on those things. Be open about that because it's a really sensitive subject.
It is a really sensitive subject, and you bring something up that I've talked about with one of the other pediatricians at the office I work at. We routinely discuss that, it's probably, I don't know if it's common knowledge, but certainly there are times when moms are looking at you to say, hey, it's okay if you give up. And then there are other times where they're looking at you to say, you've got this. This is really hard right now, but give this about, 24, 48 hours and you will already see improvement. And so there's a very big gap between those two things, but most people are somewhere in the middle. And and also it can change. You can think initially that, okay, you've got this 24, 48 hours, and then get to the point where it's like, don't think, what they really want to hear is don't think that I will judge you at all if you need to not do this.
Yeah.
And that's a very hard line to walk, but it's also really important. And I think finding the art of doing that, it takes time. And I think it takes like a certain frame of mind to really not project a personal view and to really feel empathy, not just compassion, but, empathy, and really see the person that you're working with to know where they are in that space and what they need. So it's a
I love
challenge.
that. I think that's such a good point. And I haven't even considered it from your perspective of being able to read what a mom wants and what the underlying message is, communicating some of those concerns too. Because sometimes a mother just does want to be told it's okay to make a different decision. And
Yes.
they want that validation from a professional who's seen it before.
Yeah.
But I also think that moms ultimately do know what they want. And some moms, they just don't enjoy breastfeeding, or it's like
Yes.
not enjoyable for them, or it's bad for their
Yes.
mental health, or they feel like a failure because they're maybe on a medication that suppressed milk production or like some other medical reason. And in those situations, I think it's really important to be sensitive to that. And I
I
mean,
agree.
I've had a lot of weird medical things come up through this journey, and you've helped me navigate them. So I'm really grateful for that. You helped us.
Yeah. Oh, yeah. My pleasure. I mean, I think that establishing a relationship early on, one of the things we talked about earlier is your breastfeeding journey and the goals and the things that you wanted to do. But I've worked with people who I'll walk in and I will use the term, so what's your breastfeeding goal? And get like a glazed over look in the eyes, like, what do you mean? I hadn't laid out a strategy for breastfeeding, which I totally relate to because that was me with my first. I didn't. If somebody asked me what my breastfeeding goal, I would have been like, to breastfeed, to be able to comfortably breastfeed.
Yeah. Like they not knowing there's all these different options of how to make it happen, or
Exactly. Yeah. And so where everybody is and where they're coming to it in the beginning is so different. And then their journey along the way is going to be so different, baby to baby, tongue tie, not tongue tie, low production, oversupply. There's just so many things. And so the other thing that I like to remind people is your mindset about it can change, and as you get new information, if your goal was initially to breastfeed for a year and now you're getting new information and you just want to switch to formula, I'll teach you how to wean comfortably, but I think the hardest part is what you first talked about, is making sure that you establish that relationship where you can comfortably convey what you know without applying pressure, and then leave the space to say, whatever you want to do, I got you. We'll navigate it together, kind of thing. It's a really hard thing to do.
Yeah, and I think there's so many women who they maybe end up weaning on their own because they're afraid their lactation consultant is going to be ashamed of them. And
Yeah.
instead of realizing this is also part of the journey, and that's one of the reasons that lactation consultants exist, is to help with the
Yes.
full cycle of the
Yes.
journey.
Yes. That's a really good point. And I noticed that even with for moms that I meet in the hospital who have decided right from the get-go, they know they don't want to breastfeed. It always breaks my heart if they know that and therefore they decline lactation support, because if you know right from the start that you don't want to do it, likely your milk's going to come in anyway, and that can be very painful. And
And it's really effective,
if I,
Chris. You don't know what to do with it.
yes.
Yeah, like there's so many
Yeah.
other elements to that, of course.
Yes, yeah, how to dry up comfortably and all that kind of stuff. So I think, I think it would be great if, and it's a two-way thing, right? It's two sides to the coin. It's, let's make sure everyone knows, hey, a lactation consultant can help you at every point, but then also for lactation consultants, let's make sure we're truly leaving the space for wherever they are on the journey and not projecting our private opinions, just sort of giving the information and letting them navigate which way they want to go.
Yeah, it's such a fine line, but and it's also like there aren't that many roles where people are working directly with someone who literally just gave birth. Like
Yeah.
there aren't that
Yeah.
many. Like society has built in kind of this buffer period
Yep.
for people who just gave birth, and then all of a sudden it's like, okay, go and
Yep.
now work with these moms who literally have just navigated the most difficult 24
Yeah.
hours of their life, and all of a sudden you're there to ask them and to help them guide another big decision. It's like, oh wow,
Yes.
I wasn't prepared. And that's, I think, one of the other pieces about the prenatal support is it's really helpful to think about the plan before you're in the thick of it, because once you're in the thick of it, it's really, really hard to think clearly when you're not sleeping and when you're not,
Yeah.
when you're navigating all these other life changes, especially with your first kid, I would say.
Yeah, I feel that so much. I completely agree. I think it's hard to kind of think through that stuff. And I also think, I imagine it because I remember it really, like the moments where, okay, you're trying to make a decision. So you're researching on one hand on your phone while you're trying to nurse with the other hand or hold your pump or do whatever you're doing. And it's 4 a.m. and you're in tears, and, it's a lot more emotional. It's a lot harder to find the time and the space to say, okay, I want to do this research and take this path. Whereas if you line up some support ahead of time, you at least have some ways to try before you have to start troubleshooting other options.
I agree. No, you're 100% right. It's a very good point. Very good point. Yeah, I think
So yes,
that was the other big piece I wanted to make sure I shared with you.
yeah. I mean, I think all of that's really important. I know I've told you this a million times, but I think I think that of all the moms I've worked with, your insistence on making sure you had your support lined up is really important. It probably really helped you navigate your postpartum journey more positively than you would have without it.
Oh, I'm sure this
And
saved me from postpartum depression, because feeding was the big trigger for me the first time. So I think this really was the reason I didn't have it the second time.
yeah, someone told me once that, and I haven't seen the study, so I'm not going to quote a study, but someone told me once that in 60% of postpartum depression cases, there's a feeding issue associated. Now, is it causation or correlation? Who knows? but there's usually a feeding issue. In the majority of postpartum depression cases, there's a feeding issue. So, and it makes good sense. Whether it's the tipping point or the cause, it really doesn't matter.
Yeah.
Just addressing the issues is what matters, and making a mom feel like she has agency over even the hard stuff. Like, okay, I'm going to decide whether or not we get the tongue tie release. I'm going to decide whether or not we try formula. Just being well informed, knowing the options, and being able to navigate that with the information in hand, and not having to suffer in silence, I think is the really important part.
I 100% agree with you. Really good point.
Okay, so I had absolutely everything that I wanted to hit, and I really so appreciate you coming. Is there anything else you want to throw in there, or?
I'm thinking.
Yeah.
Going back to just the GLP piece one more time with the GLP-1. I for so long really did think that self-care and prioritizing myself and my health as a mother was so mutually exclusive and separate from breastfeeding. But the more I really looked into it and the more I thought about it, the more I realized that you can really take care of yourself. And it was the same when I was ready to start a new medication for my mental health. And my provider, who is one of these postpartum specialists, said, oh, well, we would recommend weaning or something to that effect.
Yeah.
And then realized upon more research that that's not the case. So
yeah,
just proceed with caution, I would say.
Yeah. And you're right. I think that's an excellent point. Like the postpartum period where you're starting to realize that you can and should take care of yourself too it's a relief. It alleviates some of the mom guilt of prioritizing you because you need it. Oh, sweetie pie.
She's so grumpy. I'm sorry.
No, that's fine. Go hang out with her. This has been great. This is so much good information that I really, really appreciate your time.
So glad. Thank you for having me. That was so
nice.
No
problem. It's been. So that was Sienna. I'm sure, as you can see from all of the good tidbits of information that she offered, there's plenty that you can do to make sure that you have agency over your postpartum experience, whether that be lactation, whatever form of feeding that you choose, or mental health support, or that kind of thing. I can't thank Sienna enough for joining the show. If you're ever interested in talking about your experience and you want to share some things that you've learned to a wider sort of prenatal and immediately postpartum audience, we would love to have you. I think it's really important for us all to be learning from each other and sharing as much information as we can, as widely as we can, so that we're more prepared and we continue to evolve as a culture in terms of supporting our postpartum families. As usual, if you haven't, please subscribe, follow on any of our platforms. We put our videos on YouTube so that you can see the video version of the podcast. We're also on Spotify, Apple Podcasts, FeedSpot. I think there's some Amazon stuff in there. Pretty much wherever you get your podcast, you can find us. So go on there, leave a comment, leave an emoji, or send us an email to themilkproductionpodcast@gmail.com. Always love to hear from you. Really appreciate the engagement and followership. And thanks for watching. We'll see you next week.